If an embryo implants once, it can implant again. Today, I'll be discussing an important topic that many women encounter when taking a pregnancy test, the faint line. I understand that seeing a faint line can be confusing and raise questions, so today I'll be answering your questions. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I am a fertility physician, and my channel focuses on everything fertility and women's health. So if this is the kind of content you're interested in, keep watching. Before I start talking about the faint line, we need to first understand how the pregnancy test works. A pregnancy test can only be positive after implantation has occurred. And before implantation can occur, fertilization has to occur. Before fertilization, a sperm has to meet the egg. So by the end of my science-based explanation, you will have a good understanding of the different reasons for a faint line. When a woman ovulates, it means that her ovaries has released an egg. This is the time she is most fertile. When a woman has sexual intercourse, the sperm is released into her vagina and very close to her cervix. So these sperm cells will then swim into the cervix, into the uterus, and the fallopian tubes. Because the sperm has the ability to survive for up to 5 days inside the woman, it will wait there for about 3 to 5 days for the woman to ovulate. In the end, it is only one sperm cell that will fertilize the egg. That sperm cell is said to be the best and the fastest sperm. It literally has to penetrate the egg to fertilize it. When this occurs, we call it fertilization. Fertilization usually occurs 1 day after ovulation. On day 1, a zygote is formed. A zygote is a combination of the man and the woman's genetic material because the sperm has penetrated the egg. It's inserted its own genetic material. All of this is still happening in the fallopian tubes. So it will take about 5 to 6 days for the embryo to travel down and get into the uterus. While traveling down, the cells of the embryo will keep dividing, and on the 6th day when it gets into the uterus, it will now find a nice and cozy spot to attach itself in the uterus. When this occurs, it is called implantation. Immediately implantation occurs, pregnancy hormone will now rise in your blood. So implantation is simply pregnancy. This is when you're likely to pick up the pregnancy hormone called HCG using a pregnancy test. HCG first rises in the bloodstream, but when it gets to the kidneys, it will now get into the urine, and this is when you can do an at-home pregnancy test. Implantation does not occur on the same day for every woman. It can occur between 6 to 10 days after ovulation. So for a woman, the implantation occurs after day 6. It means that the embryo got into the uterus on day 6, but then it lingered there for the next 2, 3, 4 days till it was ready to implant. So it is possible to do a pregnancy test anytime from day 6 to 10 after ovulation. However, it is recommended that you wait till about 10 to 14 days after ovulation to do a pregnancy test. Remember that pregnancy test is first present in the blood before it gets to the kidney and then into the urine. So all those kits, all those at-home pregnancy test kits, it usually comes with one red line, which is called the control line. When you see a second line, whether it is faint or not, it means that the pregnancy hormone HCG was detected in your urine. The reason some women see faint line instead of a deep colored line is because of the concentration of that pregnancy hormone of the HCG in the urine. If the pregnancy test is done too early, just immediately your embryo implants, or if it is done with a dilute urine, it could give you a faint line. Normal urine color is supposed to be amber or dark yellow in color, but when it is pale yellow or almost transparent white, just like water, then it is dilute. This is why the best time to do an at-home pregnancy test is first thing in the morning when you have not had anything to drink since the night before. If weeks after a faint line you see your period, then it does not mean that you were never pregnant. Because you see that kit that you used, it can only pick pregnancy hormone. Except maybe you were just given HCG injection for fertility treatment. Then in that case, a second line will show in your urine. But if you weren't given an HCG injection, then it means that your body produced it when an embryo implanted. So hold on to that. If an embryo implants once, it can implant again. So don't give up. The real question now is, how do you know when your own implantation has occurred apart from a pregnancy test? You can know this by looking out for implantation symptoms like implantation bleeding. Implantation bleeding usually occurs once the blastocyst, the embryo that has gotten inside on day 6 into the uterus, when it attaches to the wall of the uterus. If it attaches close to a blood vessel, it could cause blood to escape from that vessel and into the uterus, which would then come out of your vagina, sometimes as little streaks of blood. Some women experience a little more than little streaks. How to know it is implantation blood and not period blood is that your implantation bleeding will be a lot smaller than your normal period blood. Also, remember that implantation occurs 6 to 10 days after ovulation. So if you have an idea of the day you ovulated, just count 6 to 10 days after that. If you notice the bleeding within those days, then it is most likely ovulation bleeding. You can also observe the color of the blood. It can be pinkish because it's mixed with your vaginal discharge, or brownish because it's little and may take time to leave your uterus and get to your underpants. So before it gets to your underpants, it may have mixed with oxygen and changed the color to brown. Not every woman will experience implantation bleeding. Only 1 out of 3 women, out of every 3 women, will experience implantation bleeding. But there are other symptoms to look out for, like implantation cramps. So this can be very confusing for some women because they experience both implantation bleeding and implantation cramp. And you know that bleeding with cramps could easily be mistaken for a period. So if you want to differentiate implantation cramp from a period cramp, you will notice that the implantation cramp will be milder than your normal period cramp. And it wouldn't even last as long as your normal period cramp. So there are other symptoms that you can now look out for, like heavy and tender breast, feeling like you're going to vomit, headaches, feeling of bloatedness. If you have these symptoms and you have a faint positive line, you can try to repeat the test again after a few days. You can also try to repeat the test early hours of the morning. That is, if initially you didn't do it in the early hours of the morning. No matter what the outcome is after you retake this test, just remember that if it implanted once, it can implant again. As usual, I'm wishing you the best in your fertility journey. If you found this video informative and you want more content like this, like this video, subscribe to my channel, share with your friends, and see you in my next video.